Hi everyone, I'm Meredith and welcome to my channel. If you're new here, I'm so excited that you found me, and if you're returning, I'm so grateful you decided to come back and watch more. Usually my channel is about all things luxury. I do a lot of content around luxury handbags and shoes and lifestyle in general, but I also have a playlist around my gastric sleeve journey. And this video today is probably a continuation of that series. So if you are interested in my gastric sleeve journey, and that's been over the last 3 years, I will link the playlist down below for you so that all the content is there ready for you, so you don't have to go back through all my videos. Today's video is about my surgery that I have just had, and that was skin removal surgery. So when you experience a huge amount of weight loss, so I've gone from 112 kilos to 50 kilos. So I've lost 62 kilos. So for those of you who work in pounds, I was 246 pounds. I currently weigh 110 pounds, so I've lost 136 pounds. So that's a massive amount of weight loss. I weigh less than the weight that I've lost now, and with that comes a lot of loose skin. So I had a tummy tuck 5 years ago when I lost a lot of weight through keto and going to the gym twice a day and a whole heap of stuff that was not sustainable long term. And I had a tummy tuck back then, and that held up really well. But I had a lot of loose skin around my backside, which was then drooping down onto my thighs, like the back of my thighs, and it bothered me no end. So I decided to have basically a buttock lift, where they put a scar around the back and lower back, and they lift everything up, and I've just had that done. So I'm going to insert all the vlog footage here from that. Just a word of warning, you will see more of my body than you probably want to, although not more than you would see if I was wearing a swimsuit. So yes, there will not be nothing R-rated here. This is not that platform, but you will see a lot of my body. I apologize. And you will see scars. So if you aren't comfortable looking at surgical scars, please be aware that I am going to show you what my scars look like post-surgery. So just be aware of that. But I'll insert all the vlog footage, and then I'll come back afterwards, and we'll talk about some of the things that made this journey easier for me, and things that I wish I'd had for my tummy tuck that I had this time around, like products that made my life so much easier. So I'll insert all the footage here. Hi guys. I am going to have an operation tomorrow, and I'm not sure if I'm going to vlog it, but I thought I should best record just in case I decide to. So it's the night before surgery. I have to be up at 4 a.m. tomorrow. My father is picking me up at 4:30 in the morning. I've got to be at the hospital by 5:45, and I think I'm my surgeon's only patient tomorrow. So basically, as a lot of you know, I have had gastric sleeve surgery, lost a lot of weight, had some health problems, and then have gone on to lose more weight. So I have now got all this excess skin. So I am going to have excess skin removed tomorrow. Now, I had a tummy tuck and a breast augmentation 5 years ago, and that has held really well. Even though I put on a lot of weight after that, and then I've lost a lot of weight, my surgeon did a really good job, and it's held really, really well. But my backside, I refer to it as the saggy baggy elephant. There is a lot of excess skin there. So that is what we're doing tomorrow. So a tummy tuck basically pulls you down, and a butt lift pulls you up. So that's what we're going to do tomorrow. So I will insert some footage here of what I look like now. So if you don't want to see that, then by all means scroll on through, fast forward through. So I'll put that in here, and then I'm not sure how much time I'll get to vlog tomorrow before the surgery, or even after the surgery, but as soon as I can, I'll start to vlog again, and then I'll decide if I actually want to do a video with this, because I'm not convinced yet. So yeah, all right, let's look at what it looks like now. So you can see here that my tummy tuck has held really, really well. So I will show you my scars. So that's the scar I've got. Hang on, let's flip you around. So these are the scars from my tummy tuck 5 years ago. So you can see I scar really well. It has faded out. It's just like, it's barely even there. It's not even red anymore. And even the ones from when I had my gastric sleeve surgery done, the keyhole, they've healed really, really well. So this is my new belly button. It is my original belly button, but they cut it out and put it there because this skin used to be all the way up here and they pulled it all down. By the way, most painful thing I've ever done in my life. So yes, the tummy tuck was the most painful thing I've ever done in my life. And I've had 2 C-sections and gastric sleeve surgery and a whole heap of other things. So if you look at my legs here, you can see that they are like, there is excess skin. But if I go like this, it's all of this. So this is just excess skin here. There is nothing there. It's just... it's not fat, it's not anything, it's just a whole pool puddle of excess skin. So basically what they're going to do is they're going to put an incision along all of my back here and cut out large chunks of my current backside and then get all of this and lift it, hang on, let's up, which should take away some of the extra curtaining I've got around here. So I don't actually have any fat through my thighs anymore. Thank you, Pilates and weight loss. But I do have a ridiculous amount of excess skin. So that is the plan for tomorrow. So that was very graphic. I'm sorry, guys, but this is important for anybody else who might be losing a lot of weight and have to consider these things down the track. So yeah, talk about putting yourself out there on the internet. All right, let's have a shower and get organized and try and get a little bit of sleep. But I'm not that concerned about sleep because they're going to put me to sleep tomorrow anyway. So yeah, all right, I will vlog again when I can. So I am out of surgery. I am feeling surprisingly well, I have to say. So I got out of surgery I woke up in recovery about 2.5 hours ago, and I'm a slow waker, so it always takes me a little bit to get like lucid, like I can answer questions and see the time and know how long I was in surgery for, but then I keep dropping in and out. So they've taken me back to my room. It's a very nice room. I have a great view. The nurses are joking it's the best room in the hotel. I don't know if that's true or not, but I'll take it. My doctor has sent me flowers, which I think is the kindest thing because I paid the man a lot of money, but still, like, kind when they send you flowers. I've had a little bit of food to eat, and I've just clicked my little green button again for the pain relief, and I'll probably drop off again in a minute because that usually makes me really tired. I think the most painful part for me at the moment is around my hips, which would be the tightest part. But surprisingly feeling really good. I've rung my husband and messaged with a few people. Yeah, so it's a win. It's way better than my tummy tuck. I've got to say, I was in agony when I woke up from that thing. But yeah, I'm really happy. My legs are currently wrapped in like compression socks that like automatically blow up and then compress and then blow up and compress. So if you hear a noise, it's that. Yeah, so I'm just going to kick back and allow myself some rest when I want to have some rest. I'll talk to my kids later. But so far, I'm feeling surprisingly good. So not going to let it lull me into false sense of security. I've got a little bump there, but I think that's probably from a mask that they put on me in surgery. But yeah, I will check back in with you guys when I can. And just for good measure, this is my view. These are the flowers my surgeon sent me. And then over there. So yeah, not complaining about the view. It's a super rainy day in Sydney, so maybe it's blue skies tomorrow. But yeah, private room, all on my own. And this is a Norwest private hospital. It's where my surgeon operates out of. It's not close to me, it's just where he operates out of. So this is the hospital that I go to. All right, I'll check back in soon, guys. So it's the day after surgery, so day 2. Do we count this as day 2? Was yesterday day 1? Yesterday was surgery day. Anyway, I had surgery yesterday. I had shocking night's sleep, and you can see it, I look terrible. But they come in every hour to do your observations, struggled to get comfortable. There was a lot of noise. It's just hospitals. So I didn't sleep particularly well. But that's okay. I have now gotten up, and the physio came around, took me for a walk to make sure I could walk independently. I think they're going to take the catheter out soon, so I'll be able to go to the bathroom on my own. Yay, as an adult. Still hooked up to pain relief, which I appreciate. I am in a little bit more pain today than I was yesterday, but on a scale of 1 to 10, it's still only like a 2 or a 3. This is so much easier than my tummy tuck. Mr. Lux is coming in soon. He's bringing me Diet Coke, which I am very excited about. And I've asked him to bring me McDonald's because I would like some fries, please. And yeah, all on track to go home tomorrow, but still haven't seen what anything looks like underneath the compression garment. So interested to see what that looks like when I go to the bathroom. But feeling really good. I wasn't dizzy when I stood up. I haven't had any nausea. I've been eating fine. Pain relief really just for the stitches, and also my body's been really sore because obviously because I've had my backside done, I was on the operating table for several hours on my stomach, so my ribs are a little bit sore from like having all that weight on my ribs for so long. And just staying still, like I couldn't get out of bed and I couldn't move much around in the bed for, almost 24 hours. And that was rough on my body, which is so used to movement. Doing the Pilates has been really good because when she's like sit up, my stomach muscles are really tight. I've got a really strong core, which is handy for recovery, but it's not good when your body is used to so much movement to ask it to stay still for a really long time. Things start to ache really badly. I was so grateful when the physio got here. I was like, oh, thank God, I'm going to get out of bed and move. So I'm currently sitting in a chair in my room just to have some uptime. More than happy to not go back into the bed for a while. I'm just going to hang here until Mr. Lux gets here. But so far so good. I'm feeling good. So that's my update. I'll check in with you guys later. So it's the end of day 2. I've just seen my surgeon, Dr. Eddie Donner. He works out at Bella Vista in Sydney. I've used him before. He's an amazing plastic surgeon, and I'll use him again in the future. So if you are after a plastic surgeon, he has people from all over the country fly in and see him, and I highly recommend him. But anyway, he's just dropped by and had a look at the wounds. He says everything looks good. He said the surgery was really great. He showed me some very graphic photos of the amount of skin that was removed, or video, and while I'm sure he would give it to me, it's a little graphic for YouTube. Yeah, I don't think I'll put that up. I might keep it for myself, but I don't think I'll put it up. But yeah, he says the drains can come out tomorrow morning. I can have a shower and go home. So that's all good. So starting from Monday, I will have treatment in surgery with my doctor 3 times a week for the first 2 weeks, 2 times a week for the second 2 weeks, and once a week for the 2 weeks after that. They will take my blood and separate the plasma and then inject the plasma into the wound site to help it heal. They'll also do light therapy on the wound sites so that the scarring is minimal and it can all heal very well and very quickly. This is a new process that they're doing since the last time I had any kind of plastic surgery done, so it'll be certainly interesting. So I'll probably maybe check in on with you over the weekend depending on how I'm feeling, or maybe when I get home tomorrow, and then I might take you along for some of those appointments before I finish up this vlog, just so that you've got an understanding of how that process works. But yeah, it's been a really positive experience. I'm happy with it. Obviously, things like this take a good 6 months before it all settles down. So yeah, maybe a follow-up video. But yeah, feeling good. Tired, looking forward to seeing if I can get some good sleep tonight. But really happy with how I'm feeling and the progress I've made and being up and getting around and being mobile. So yeah, it's been I wouldn't say it's a fabulous experience, but it's been an easy one, let's put it that way. So yeah, signing off for the night. I'm gonna try and close my eyes for a bit. Bye guys. It's home day, so I am detached. Sorry, I still have the cannula in, but I am detached from the drip. I still have drains in, they're about to take them out. And then I get to have a shower. I'm so excited about having a shower. I feel icky and greasy and gross, and it's going to be the best shower ever. So after I do that, I can go home, which I am very excited about, and see my kids. But yeah, I'm doing really well. Still in a little bit of pain. They're sending me home with pain relief, obviously. But yeah, I think I'm doing all right. So happy and healthy and free, which is very nice. And yeah, just looking forward to having a shower and washing this greasy mess on my head and cleaning my face properly. And yeah, it's like those first showers after you get off a really long flight. It's like just the best. So looking forward to that. But yeah, I'll check in with you guys once I make it home. So I thought I'd do a quick update for you guys. I've been home now, I got home day before yesterday. So today is now Sunday. I had surgery on Wednesday. So what's that? Thursday, Friday, Saturday, Sunday. So I'm 4 days post-op. I'm feeling pretty good, I've got to say. I am down to pain relief 3 times a day. I try not to take it too much because it makes me drowsy, but it also, I really struggle to follow any kind of conversation or keep thoughts in my head while I'm on it. And I'm hoping to go to work on Tuesday, so I'd like to not be on the pain relief. Overall, I'm feeling really well. I'm getting around okay. I'm pretty much independent. I guess it only things like I can't unstack our bottom dishwasher, like we've got drawer dishwashers. I can't bend over that far. But other than that, I'm pretty much doing everything that I would usually do, maybe a bit more slower. Although you can see in the background there, our bed is not made properly. I'm doing as much as I can without doing too much. My husband's being really good. He's doing everything that he can to make sure that I'm comfortable and have what I need. I thought I would show you what I look like in the garment, the compression garment, that I have to wear post-op, and I'll wear this for 6 weeks. So let me show you what that looks like. So it's super sexy, as you can see. So I've just got on a sports bra with it, and then I've got underwear on it as well. So the actual garment itself has a big hole through the middle of it so that you don't need to take it off to go to the bathroom each time. So I just put some underwear on to maintain my modesty. But yes, this is what it looks like. So it's got these little suspenders on it. It's not the world's best design at the top. The one that I had for my tummy tuck was basically an all-in-one, and I could just wear it. I didn't have to wear a bra with it, and I would have much preferred that, but this is what they've given me this time. I've just had a shower, so some of the wounds are still, like the dressings are still damp, and that's just made the back damp, but that's fine. And then this is what it looks like from the back. So I'm still really swollen through here because this is where all the stitches are around here, and they come all the way to here on the front. So there's a section in the middle that has no stitches, and then the stitches start here and go all the way around and back to that side. But I'm still really, really swollen, but I'm feeling all right. Yeah, I think I'm going all right. I get tired really easily. My mother keeps saying you just got to listen to your body and rest when it tells you to rest, but I've never been good at that. But yes, this is what it looks like, and this is what I am in 23 hours a day at least for 6 weeks. It doesn't really worry me. I'm happy to be in it. I'm going to wash it tomorrow because I only have one, but it'll wash and dry within the hour. So yes, and yeah, going okay. So tomorrow I go see my doctor. I don't actually see the doctor, I see the nurse, and we start therapy there. So I'll give you a wrap up of what that entails tomorrow, because it's supposed to be light therapy and something to do with plasma treatment as well. So we'll go over that tomorrow. All right, guys, I'll see you later. Hi guys, so it's been a minute. I'm a week post-op today. I'm looking worse for wear because I haven't been able to shower for the last 2 days because they changed my dressings and then they weren't waterproof, the new ones I put on, and I just had to wait until they came off today. So it's been 2-3 days since I've had a shower. Really looking forward to a shower. But because I'm about to jump in the shower, I have nothing, like I've taken everything off and you can see the wounds now. So I'm going to show you the wounds. If you do not want to see this, please look away, or I don't want anyone seeing anything that's going to make them uncomfortable. But they're healing really well. Even a week in, they're holding really well. They don't need to be covered anymore. I can shower like normal. I have a cream I need to put on. I think when I do this video and I put the vlog in, I will do an intro for you guys, and I will also do an outro and list all the things that have made this this recovery time so much easier because I have them. So I'll do that at the end, so stay tuned for that. But right now I'll spin you around so you can see the stitches. Please, like, just if you're not comfortable with that, please fast forward this bit because it is quite confronting. I'm okay with it because I've seen stuff like this before, but I understand a lot of people would be squeamish with this. But if it's something that you're considering having done, it's probably a really good thing for you to see so you can see what you're dealing with. Okay, all right, I'll spin you around. Okay, once again, more Meredith than anybody really wants to see, but this is, you know, it's essentially a bikini that I've got on. So these are what the scars look like. So you can see it goes from, so this part here, there's no scar. That there is my previous tummy tuck scar. And then if I spin you around, it goes all the way around. So you can see there's definitely a whole heap less skin there now. I'm still very swollen, and I will be for quite a while. So these are not final results, and don't panic if you thought, oh, they look so much better, but you don't. It will get better as the swelling goes down, but there's a whole heap less skin that's been taken. So that is what my scar looks like. It goes from there to there. Traditionally, with this type of surgery, a lot of surgeons will stop here at the hip bone, but because I'd had previous surgery, my doctor took this as an opportunity to do a little bit of revision on the last surgery. So he took a little bit of extra skin because even though the tummy tuck had held really well, it gave him an opportunity to take a little bit of extra skin and just pull me a little bit more taut, which I'm not adverse to. So yes, that is where we're at. So yeah. So hopefully that's helped some of you. I will throw back to myself now. I won't continue with this vlog. It's going to be the end of what I actually vlog. Maybe I'll do a 6-month follow-up at the very end, so you guys can see what the scars look like, you know, when it's all done and dusted and everything's healed. I am seeing my doctor 3 times a week. I do light therapy, I do red light therapy, and I do infrared therapy. And I'll talk about what I'm putting on things and how that's all going, and I'll make suggestions on products that I think are really needed if you're having a tummy tuck or any kind of skin removal surgery, just things that make life a whole heap easier. So I hope you guys have found this really informative, coming along with me on this journey. Okay, I am sorry to all of you who saw more of me than you ever wanted to see, but I think it's important for you to know what you're getting yourself in for if this is something that you're looking at doing, because it's a massive undertaking. This is major surgery you're looking at. So yeah, I want to be as transparent as humanly possible, and I encourage you all to ask me questions in the comments down below, because that's what I did before I had surgery. I did a lot of research, so I'm more than happy to answer questions, and I've always been really transparent about my weight loss journey, so feel free to ask me anything. This time around, there were things that I got and that I had that have made this experience better for me than when I had my tummy tuck. My tummy tuck was by far the most painful thing I've ever done in my life, and I wasn't prepared for that, and there were several things if I had would have made that an easier journey for me, most certainly. And a lot of these would apply to any kind of surgery that you're going into, whether it's skin removal or, you know, I've got a friend who's just has shoulder surgery, and she had some of these that just make life a whole heap easier. So I'm going to link everything down below for you. So, and most of it, well, all of it pretty much comes from Amazon. So I've stuck with a really neutral website where you can access these things easily from pretty much anywhere in the world. It is important to note that my plastic surgeon requires an aftercare program that very few do. So for starters, in Australia, you don't go home the same day as you have surgery. So I know in the States, plastic surgery, you go home the same day. Here in Australia, you do not. I was 5 nights in hospital with my tummy tuck. I was 2 nights in hospital this time around, and I could have chosen to stay as long as I wanted. I have private health insurance that covered my hospital stay, but as long as you're paying for it, they don't care, and it's not as expensive here as it is in the US. So you stay for as long as you want to. I've also never gone home with drains. I know that some plastic surgeons in Australia will allow you to go home with drains. Mine does not. If the drain's in, you stay in hospital, which I'm fine with because I'm scared of infection anyway, and I don't want to be dealing with drains, and makes me very nervous. So I didn't go home with drains in. And I have a very strict aftercare program. So I have to go have light therapy with my plastic surgeon 3 times a week for 2 weeks, twice a week for 2 weeks, and once a week for 2 weeks. And we do 10 minutes of red light and 10 minutes of infrared light. And that's made huge differences in my scars, I've got to say, and how quickly they are flattening, and also the redness in them is going. So huge difference. I've got a very important cream that I am using this time around, which has made huge differences. And obviously the garment, I think they call it a faja or something like that, but you know, it's essentially just a bodysuit that tucks you all in together. That's really important as well. So let's talk about some of the things that I think you should consider if you are going to have surgery like this, or really any type of surgery. So first and foremost, a thermometer is really important to have at home, because if you spike a temperature, that's your first indication you might have an infection. So we have a thermometer anyway here at home because I've got kids, but if you don't have kids, you might not have a thermometer in the house, and I really suggest you get one, because knowing you've got a fever is really important. At one point in my recovery, I went to my husband, I'm feeling a little bit warm, I'm just going to take my temperature, because I was so aware that I did not want an infection. So get yourself a good thermometer. Like I said, I'm linking all these things down below. A portable charger. So a phone charger, like a power bank, was really important to me, because when I got back to the room, I was the only one there. My husband didn't come and see me until the next day, and I wanted to be able to text and talk to people that I wanted to let know that I was okay, but I also didn't want to be in the nurses' faces about things. So I found a fantastic power bank that has 3 different adapters that are embedded into it, and that make my life a whole heap easier, because my AirPods run off a lightning charger, my phone runs off a C, and this has also got a USB attached to it. So I've got some brilliant chargers that I bought a couple of years ago when I traveled, but they don't have the cords, and you've got to have different cords all the time. This one has the cords built into it, and I cannot recommend this portable charger enough. If you're traveling, if you're going to have surgery, even just day to day, this charger is absolutely my favorite now, and I love it. So I've linked it down below for you. A good overnight bag is really important for the hospital, but not a showy one. So I've got countless Louis Vuitton keep-alls and expensive bags. You don't take them to hospital with you, because you're not going to see your bag for hours. You don't know where it is. Even if it's locked, it needs to get to your room. So I always go with a very low-key overnight bag when I go into hospital. And I've got some great ones from Amazon that I really love that I'll link down below. Also, really good toiletry bags. Once again, I've got countless Louis Vuitton and high-end brand ones. I don't take them to hospital with me ever. I just want something that's easy, that's going to fit the stuff that I want to take. You don't take a lot of toiletries to hospital anyway. You just need the basics, although I do take shampoo and conditioner, because the first shower when I wash my hair makes all the difference, but my hair dries in minutes, and if you're someone who takes hours to dry your hair, you're not washing it in hospital anyway. So you just want your toothbrush, your toothpaste, some basic face cream, just for hydration, maybe a hand cream for hydration, but you really don't need a lot when you're heading into hospital. But so just get a little toiletry bag, just an everyday one. I'll link one down below for you. Like I said, the red light treatment I am having now has made such a difference to my journey and the elasticity and look of my scar. I can see that. Having had 2 surgeries at 2 different times, 5 years ago, my plastic surgeon did not do this therapy. He does now, and I see such a huge difference. You can get light therapy devices off Amazon. I will have them linked down below for you. I highly recommend. I go in, I have 10 minutes of red light and 10 minutes of infrared light, and it's made such a huge difference. Obviously, in salon ones or in doctor's surgery ones are going to be a much better grade of light, but even the Amazon ones will make a difference. I would just up that. So maybe do 20 minutes of red and 20 minutes of infrared, but huge differences. I highly recommend. Liquid IV or a hydrator is really important. You want to flush your system after surgery because you have had, you know, all these drugs put into your body. You've had the anesthesia that's put you to sleep. You want to flush that out as quickly as possible to get yourself moving again. Also, it moves the pain relief through your system, and so it's not lingering and you don't end up really bloated or really constipated. Also really important, hydration is for constipation and the drugs that you're going to be on. So like a Light or a liquid IV are really important for that. I always have liquid IV here at home. I drink it every day. It keeps me hydrated, but I strongly recommend it. A silicone straw, because you're laying in bed in the hospital afterwards, unless you've got someone with you all the time. I'm someone who doesn't want to ask the nurses every time I need something, but they give you water in a bottle or in a cup and you can't move a whole heap. You're trying to stay fairly still, especially for those first 24 hours. I wish I'd had a silicone straw in hospital because it would have made my life so much easier, because I'm trying to open a full bottle of water and I'm on a recline and I'm trying to drink it without spilling it all over myself. A silicone straw would have made my life so much easier. Movicol, really important. You want to be on Movicol 5 days before you go in for surgery, I want to say. The amount of drugs they're going to pump into your body is going to make you constipated. You want to make sure you have got Movicol in your system before the surgery and every day after. Now, Movicol is part of my routine afterwards. Like, my doctor had it built into my routine. The nurses gave it to me and I got home. I just took it myself. But taking it 5 days beforehand gets it through your system, and I didn't have any issues, none whatsoever. And they kept saying to me, are you all right? Are you feeling bloated or constipated? And I was like, no, I'm good. My system was solid. So I highly recommend it. I also kind of wish I had had a reacher tool, like a grabber, because the nurses would come in during the night and take my observations, which they do every hour when you're in hospital, especially for the first 24 hours. And I had my table set up with all my bits and pieces, like my phone and my water and everything else I needed, and they'd move it out of the way. And then sometimes they'd go and I'd forget to ask them to move it back, and my water would be on the other side, like out of reach, and I can't reach that far. So I wish I'd had a grabber tool, because then I'd have to ring the bell and wait for them to come, because I'm like, can you just put my table over here? I feel like such a pain asking for that, and I know they get paid for it, but I wish I would have had a grabber tool. It would have been really handy. And once I got home, I couldn't bend over, and this was both with my tummy tuck and with this surgery. Bending over becomes a problem, so having something that picks things up off the floor for you makes life so much easier. So I highly recommend getting a grabber tool. I'm also going to have linked down below a really good robe to take with you, like a bathrobe to take with you to the hospital, because, you know, they want to get you up and walking as soon as possible. And even if you're at home, you want to be up and walking as soon as possible. But a robe is really important because you don't want to be exposed to the whole world with the hospital gowns. So I'll link a good robe down below. I'll also link a really good pair of slippers down below, because you don't want to be walking around barefoot through the hospital hallways when they're making sure you're mobile either, but you want a solid sole. So something that's soft on the top but hard on the bottom to give you that kind of stability. So I'll link some slippers down below, and a fantastic nightshirt that I have a variation of. This is the one I'll link down below is from Amazon. Mine's from a different brand, but it has buttons all the way down the front, and that makes life a lot easier for getting in and out when they're checking things. So highly recommend that. I'm also going to link some compression socks. They give you compression socks in hospital, but they're not fabulous for wash and wear, and you're in a lot of pain afterwards and your muscles hurt, and trying to get compression socks on and off is hard work if you don't have someone with you all the time that can help you. These ones have zips. The ones that I found on Amazon have zips, and they make life so much easier for someone who can't move a lot, who's you know, got a lot of stitches to try and get on and off, as opposed to the ones they give you in hospital, which require you to kind of pull them up really tightly, and you really can't do it yourself after surgery. So highly recommend compression socks with zippers in them. Make all the difference. AirPods are an essential for me because they have noise cancellation, which means I sleep better when I am in hospital. So I sleep with my AirPods in on noise cancellation, and that makes my life so much easier because there's a lot going on in hospitals with dings and bells and all sorts of things. So get yourself some noise cancellation headphones. I just wear my earpods because they sit inside my ear and I can still sleep in them. So love that. Highly recommend a multi-charger to go with you. So one that has C ports and USB ports, or a couple of C ports and your cords that go with that, because there's not always a whole heap of PowerPoints available to the patient. There's a lot of PowerPoints, but they're being used for machines. If you've only got access to really 1 or 2 PowerPoints, having a charger that's got multiple ports on it that you can run a few different cables off it to charge different things. When your power bank goes dead, you can charge your power bank, you can charge your phone, you can charge your earpods or whatever, AirPods or whatever. It just makes life easier. So instead of trying to change them in and out, or waiting for somebody to come, or asking a nurse to change the different cords in and out, run one PowerPoint port that has like 4 or 5 different things in it. Have the person who's visiting you plug them all in, and then you can charge what you need to charge when you need to charge it. Makes life so much easier. A little pill box, so just a teeny tiny one, is also really handy to have, because I was on medication 3 times a day, so I didn't want to carry all the boxes of medication around with me, but I didn't need a big pill box either. I just needed something for the middle of the day. So I'd be home for the morning and home for the night, but in the middle of the day when I'm out and about or at work, I just needed a really little pill box to put 3 or 4 tablets in. So that was really handy to have. A stable table. Does anyone remember when stable tables came out? I do. I remember the advertising campaign. But I would sit on my chair at home, and like, I've got a side table and stuff, but if I've still got to stay reclined all the time. So to eat, I'm kind of leaned back, but a stable table made me able to eat my dinner in that chair, and it was comfortable for me, and it just made life easier. I also had my laptop on it a lot of the time if I wanted to work, so I strongly recommend a stable table. It'll make your life easier. A Stanley cup. Doesn't have to be a Stanley cup, but a water bottle, definitely a big one that you can keep a lot of hydration in at any one time, because it will remind you to hydrate constantly. You need to stay hydrated. It makes all the difference to your recovery. I will also link down below several garments, or like fajas, that I think are great for both a tummy tuck or a butt lift, or I think they call it a 360, where they do all of it. Really good ones, as well as a belly band. So I had a faja, a belly band, and a back brace, like a lumbar board, just at the back to stop swelling. So I will link all of those down below. I was given them all with my plastic surgeon, but the faja, you have to have it on all the time, but you really need to wash it. So I ended up with a second one as well, so I could wash the first one and the second one, put the second one on while that happened. A boomerang pillow. Oh my God, I've bought so many boomerang pillows. I have them all over my house now. I sleep with them. They're on my chair at work. They're on my chair at home. They just made life so much easier. I'm not sure if you would call them a boomerang pillow in other countries. We call them a boomerang pillow here. It's just a triangle pillow essentially. But I didn't have them for the last time I had a surgery. This time around, I am so glad I have them, and I now have so many, and I'm just gonna flat pack them, like vacuum seal them, in case anyone has surgery. I know that I have another surgery coming up. My husband's probably gonna need surgery next year on something. So I'm just gonna keep them because they've been great for that. Most important thing that I bought in all of this was my orthopedic bed wedge pillow set. Now, my friend Dale had shoulder surgery, and she bought the same set, and it made such a difference. I wish so much I had had it for my tummy tuck. It's this 4-piece wedge set that helps you, like, it almost gives you a hospital bed in your own bed at home. It keeps you on the angle you need to sleep on. It's comfortable. It is by far the best thing I bought in all of this. If you buy one thing, buy this pillow set. It will change your recovery from this surgery. And as I said, my friend had it for her shoulder surgery. I would recommend it for any kind of surgery you're having. Buy the pillow set. It is worth every cent, and it made so much difference to me. Also, I needed a donut cushion, so I don't have a lot of padding on my backside, and to stay in the one position for a long period of time, I get a very sore tailbone and sacrum bone, and I ended up having to buy a donut pillow just to get off those bones when I had to sit on them for long periods of time. I was in agony in hospital where after 24 hours of staying in the same position, and if I ever do surgery that's similar again where I'm not going to be able to move around a lot, I will take my donut cushion with me to put under me in hospital, because I was ringing my plastic surgeon going, they've got to get me out of bed or I'm going to do it myself, because I cannot stay in this position any longer. I am in huge amounts of pain. And they sent the rehab person to come and get me up out of bed at that point. I was just stand up anyway, but I could not stay in that position any longer. So definitely the donut pillow for me. If you're not someone who experiences tailbone pain on a regular basis, you might not need it. So I wouldn't necessarily buy it going in, but I definitely needed it as soon as I got home. And I was so happy that Amazon do overnight shipping because I was desperate for it. I don't think there's any, oh, the cream, last thing. One last thing. So the cream that I am using, it's called Synchro Cream from Genetic. And it's a French cream, and it was developed for burn victims to use on their scars. And I didn't have it for my last surgery. I've got it for this surgery. It's not cheap, but oh my God, is it good. So I will link it down below as well. It is great for all skin types. It's great for any kind of scarring you've got. So if you've got bad acne scarring, they recommend this. Any kind of scarring you have, this cream will make a huge difference to it. And I'm loving it. I've already bought more of it. I got one tub of it free from my, well, not free, it was built into my program from my plastic surgeon, and I've already bought more of it. I will always keep it in the house. So any kind of scarring that you've got, so if my kids like, cut themselves or whatever, I would put it on it. And it's beautiful cream, and like I said, it was developed for burns victims and their scarring. So that'll definitely be linked down below. Highly recommend it. I am loving the whole product range from them, but this cream particularly, if you've got scars, look at this. So yeah, definitely one that you want to think about. So they're kind of all the products I think you can consider. I'm not saying you should go out and buy them all if you're going to have surgery, but there's certainly things in there that made my life so much different. If nothing else, buy the pillow set, buy the power bank, because that definitely made my life a whole heap easier. Make sure you have a thermometer. That is so important. Make sure you've got some kind of water bottle and an ability to stay hydrated. The Movicol, please, please, please do that. But yeah, the rest of it you can kind of take with a grain of salt. Do you really need a boomerang pillow? Do you really need a stable table? They're just suggestions of things that made my life easier. But there were definitely things that I would absolutely, that I absolutely wish I had the first time around. And I would not go into surgery again without having them here, because they just made such a difference to my recovery and how easy it was. So I hope that's been helpful for you guys. If you've got any questions, please, please, please ask me down below. Make contact with me over on Instagram, wherever. I am more than happy to answer questions. Do I have more surgery coming up? I probably do. I think I've got one more skin removal surgery that I want to do, maybe at the end of this year, and then I will be done. And there is some train of thought about, is it worth it at my age to continue to do this kind of surgery? Don't I just want to live with my body? But I don't, and it bothers me no end to see so much excess skin. And I think you do what's right for you and to make you feel like you. So yeah, I think I've probably got one more surgery to come. I don't know if I'll vlog that or not, but I hope that this one has been helpful for anyone who is considering surgery for skin removal after huge weight loss. And please ask me questions. If you've liked today's video, please give it a thumbs up and hit that subscribe button down below. It means a lot to a content creator when you hit that subscribe button. Please also hit the little bell notification so you know when I upload videos, which is usually twice a week. I'll also throw up my Instagram handle for you so you can follow me over there. I put lots up in real time, lots around my collection and my day-to-day life, so please come follow me over there. I hope wherever you are in the world today, you are having a fabulous day, and I'll see you guys in the next one. Bye guys.